Hello, good evening. Dr. Chide Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to today's event. Today, we're going to look at the impact of infertility management, and a couple of other protocols which we use in helping couples that are believing God for babies, but who might be having problems. Can infertility management Can infertility itself, as an isolated factor, affect your mental health? So, we're going to look at it critically. We're going to look at top 5 ways infertility can lead to mental health problems. And we're going to take a look at things you can do to get help. Now, it's important you understand that infertility is a temporal thing, it's not a permanent thing. You will eventually be a mother, you will eventually be a father, but you need to seek help. So, the essence of today's clinic is to guide you appropriately, to give you tips, to encourage you, and use some informational and educational materials to connect you to care. Infertility is a very common problem out there. Matter of fact, globally, 1 in 8 couples will have infertility. 1 in 8, think about that. That's about 12% of married women. So the infertility you're suffering today, it's not permanent. But the outcome, how soon you will defeat infertility, is dependent on your approach to infertility. You have to guard your mental health jealously because sometimes you won't even know when you develop the mental health problems. Sometimes before you blink, it's already late. Now, anybody can develop mental health problems. Mental health doesn't have any boundary. But unfortunately, the state of infertility, especially long term infertility, can lead to mental health challenges. And on the flip side, mental health challenges can also affect your fertility negatively. So they have a symbiotic relationship. Unfortunately, it's not a positive relationship. So please, when you come in, let's know who you are. Admin is currently in the clinic. Thank you so much, admin. So please announce your name. I want you to come with an open mind. I want you to come to onboarding your infertility issues tonight. I'm going to walk the walk with you. And at the end of the day, if you get the help you need, you will succeed. The reason is because the route and the road to getting success when you're going through infertility, it's rough, it's entailing. It will affect your physical health, it will affect your social health, it will affect your religious health, it will affect your emotional health, it will affect the totality of you, even pain. So, but you're not alone. So, this evening, we're going to take time to understand the 5 different ways infertility can affect your mental health. Now, it's also important for us to understand that your mental health can mirror your physical health and general health. So, what do I mean by that? You see, it's not only when you have headache, you go to the doctors. Sometimes you might not have headache. Sometimes you might not have fever, but you're sad. The fact you're sad, the fact you're not sleeping, the fact you're no longer interested in things that make you happy is a red flag. So, the same way we seek help when we feel we have malaria, when we feel we have typhoid, should be the same way we should seek help. Sometimes what you need is talk therapy. We have also discovered that couples that go through infertility, that seek professional help, that seek psychological help, will defeat infertility earlier than couples that don't actually communicate. Why? Infertility is the biggest enemy in loving relationship. Infertility can damage a Romeo and Juliet relationship if you're not careful because you cannot escape the frustration. Sometimes you expect that your period is not gonna come, then suddenly your period comes, and you might not be able to communicate your frustration to your partner, especially women. How men react to infertility is not the same way women react to infertility. Women react to infertility entirely different. So you might be with your loving partner before you guys started looking for babies. You guys love each other 100%. Now, you also have to be mindful of the people you associate yourself with because sometimes people might give you wrong advice. Sometimes people can pitch both of you together. Instead of working as a team, you'll be working independently. And this can cause a lot of strain in your relationship. Now, some women do no longer sleep. When you are not sleeping, you will be irritable. When you're irritable, your libido will be down. When your libido is down, will you make love around the corner? No. Will it affect your infertility? Yes. So everything is all connected together. So let's see who is in the clinic tonight. And please feel free to ask all your questions after my presentation. Kenneth, thank you so much for coming. Tosi, Angie Love, and Tosi. Okay, so we have the regular crew that normally attends our clinic. Now, please, if today is the first day of attending my clinic, our clinic is pretty much informational, educational, public health oriented. The essence of coming forth with this clinic is to help you to understand the steps you're going to take. It's not a replacement to providing care from your personal doctor. It's not a replacement to consulting a professional. It's not a replacement to put your own symptoms and begin to self-treat yourself. Please, that's not the intention. I intend to give you the tips. I intend to give you the awareness so you can take the steps you need to take. Okay, so we're going to quickly start. We're going to talk about the 5 different ways infertility can actually lead to mental health problems. It's important we pay attention to this because you might actually be suffering from this and you won't even know. Now, infertility at itself in isolated form is one of the biggest risk factor to developing mental health problems. Unfortunately, mental health problem doesn't have boundaries. So the rich, the poor, the short, the white, the black, anybody can develop mental health problems, especially when you're not getting care. So infertility itself is an isolated risk factor. Now, infertility can predispose or be a direct causative effect or be an indirect causative effect to developing mental health problem. Number one on list is one of the commonest presentation of mental health problems in people, depression. You see, there are so many people that struggle with a lot of things. They might be going through some stress and they can self-diagnose themselves that they have depression. That's not depression. There are clinical ways of diagnosing depression. You might not be feeling good. Everybody feels down some days. There are some days you wake up, you don't just feel good. It's called mood swings. The fact you're having mood swings doesn't qualify you to call yourself depressed. So many people have banished themselves and branded themselves depressed, but you're not depressed. You are just going through life challenges. But the possibility that when you have a long-term infertility can lead to mild depression, moderate depression, and severe major depression. Unfortunately, when you don't consult the right professional, when you spiritualize your depression, it's going to get worse. Unfortunately, where we are from, in Africa, in developing countries, we stigmatize mental health. We stigmatize people that have depression. Nobody wants to tell anybody that they have depression because they feel that if you have depression, you're going crazy. But the earlier you seek help, the better. When you develop signs of mild depression, we can actually mitigate development of moderate or severe depression. Unfortunately, one of the end products of depression is suicidal ideation. So there are some people that might be going through tough time, especially if you have a very difficult partner, you might end up not getting the help you need, and your mental health coming from depression can be severe, and you can have complications up to the point of being suicidal. We have had couples that one of them probably was nonchalant, he or she wasn't really paying attention, or some men might be making it difficult for the women, they might not be participating, and before you know it, a very lively lady, a very easygoing lady will start withdrawing herself. Before you know it, she can develop depression. And unfortunately, in most places, when you develop depression, you spiritualize it. So when you have signs of depression, please, I understand the need to go to church. I understand the need to pray about it. But guess what? Prayer cannot take care of clinically diagnosed depression. And depression is not something you control. Anybody can be depressed, including me. At some point in our life, we might have been depressed without knowing. But when we consider ourselves privileged, when you seek help early, you can deal with depression that might come from long-term infertility. Now, people are wired differently. There are some people that are very strong. There are some people that can handle 20 years infertility and they will still be strong. But there are some people that might not handle 1 year infertility, 6 months infertility. So people are wired differently. It depends on the person you're actually hanging out with. It depends on your type of partner. It depends on who you're getting help from. But by and by, one of the critical areas infertility can damage your mental health is through the area of depression. So infertility directly can lead to depression, or it can be a predisposing factor. So you might have other things that might come in to complicate an already existing mental health challenge. Let me give you an example, excuse me. It's possible you don't have a job. It's possible you don't like your partner. It's possible you don't have money. Then you don't have a baby. So you can see how other factors can come in to make an already existing negative condition worse. So number one factor I want you to focus on today is what? Depression. Infertility can lead to depression, and when you're depressed, your ability to play the normal role you're supposed to play that will enable you to become pregnant will be depleted. So most people that have depression will likely not have good libido. Now it can flip on the opposite side. There might be some couples that when they are depressed, their libido can go up. But generally, when you have any of the mental health problems, your sexual life will be affected, and your sexual life is very important in the process of developing a very stepwise approach to developing a very good outcome. So when your sexual life is not in a good place, you will not be able to engage in the preach 48-hour lovemaking. You will not be able to even begin to seek help. You begin to adopt poor habits, which can even make it worse. Number two, anxiety disorder. We all get anxious once in a while. But if you are anticipating that your period is going to come when you don't want your period to come, if you are anticipating a negative outcome from a procedure, a negative result from IVF, a negative result from IUI, which you have spent a lot of money, and if you are anticipating that that bleeding is going to come again, which you don't want, it can stoke a lot of anxiety. Everybody gets anxious, but infertility can damage your coping mechanism to the point you might have severe anxiety disorder. Severe anxiety disorder can also be an isolated factor that can directly rob you of your ability to overcome infertility. At some point, majority of the couples out there had infertility. It's just that nobody wants to talk about their negatives. We always want to showcase our positives. Now, some couples that also have infertility might suffer what we call social anxiety, social withdrawal, and isolation. Previously, you're a very party-going person. You're very sociable. You have some very good friends. You are outgoing. You go for all the parties. Suddenly, the journey you began with a lot of excitement, the number of babies you want to have, the number of baby boy, baby girl, twins, triplets you want to have, they are not forthcoming. Suddenly, a sociable lady will start withdrawing herself. Suddenly, a sociable guy will start withdrawing himself, even to his own nuclear family, your siblings, your parents, your colleagues. You're just reclusing into yourself. You are no longer doing things that used to make you happy. You are completely withdrawn from the social circle. Why? Because the possibility that your friends might have babies, the possibility that might be doing baby shower, the possibility they might be posting their baby pictures in their social media, you want to close your social media account. You close your Instagram, you close your Facebook, you close everything so that you won't see all the joy and the positive things that your friends, your sisters, your colleagues are sharing. You begin to withdraw yourself. You begin to have a lot of anxiety. You no longer sleep. You begin to eat the wrong kind of food. You begin to isolate yourself completely from things that used to make you happy. Previously, you used to go to movies. Previously, you used to go to parties. Suddenly, you no longer do all these things. You no longer communicate. You are completely the opposite of you. That's a red flag. Infertility can cause this. Now, in this era of people going out there to stoke up a lot of emotions, there are so many artificial things going on in social media. But if you see everything like in real life, you might see your friend, and something good that happened to your friend can actually stoke a negative effect. I have seen women that develop severe panic attack, severe anxiety whenever they see pregnant women. Whenever they see babies, You are not going crazy. I know some people will think, oh, maybe you're jealous, or maybe you're that. It's a human nature to feel like you're left alone when you want something and you don't get it. So when you see a pregnant woman out there and you don't really feel good, when you see babies out there and you begin to feel down, it's okay. But what you need to do is to seek help. It's an emotion that is out there, but you need to exhibit the matured emotion. That's the point. You need to seek care and help. Now, also, couples that go through infertility will begin to lose their self-confidence. There are so many beautiful women inside and out there, beautiful outside, beautiful on the inside, well-educated, well-connected, even wealthy. But when they begin to go through a lot of infertility, they begin to lose their confidence. They begin to lose their self-worth. They begin to have body dysmorphism. You begin to look for things that might have caused this infertility. Everything around you is the likely cause. The food you eat, the friends you keep, the clothes you wear, where you go to, you feel that you're the cause of the problem. You feel like you're isolated. But that's not how it works. Anybody can have any of the things I mentioned. Now, the fifth point is eating disorder. So infertility can lead you to be anorexic. Anorexic means you pretty much withdraw yourself from eating because you feel that, oh, maybe it's the food that is causing it. Or you might be bulimic. When you eat, you vomit. Or you can be on the other side, you eat more. When you adopt any of these things, what will happen? It will affect your weight. When it affects your weight, what will happen? It will affect your BMI. When it affects your BMI, what will happen? It will affect your hormones. When it affects your hormone, what will happen? Your ovulation. So you can see they are all connected. So majority of women that go through infertility actually have eating disorder. Either they are not eating at all or they are overeating. There are some women that have tripled in their body weight because they are not in a good place. We take comfort in eating. Now, also, when you are treating infertility, unfortunately, one of the side effects or adverse effect of a couple of medications out there for infertility is what? Changing your mood. So some of them can stoke, bad mood. Some of them can predispose you to depression. I'm talking about drugs we use in helping people to become pregnant. There are some of the injections you might be taking, and if you're not strong, if you don't have good support system, they can have adverse effect. Now, some women can also begin to accumulate a lot of fluid in their body when they are going through infertility treatment. These are all verifiable, fact-based ways infertility can affect your mental health. Everything I've taught you guys this evening, they are all connected to your mental health. The eating disorder, the lack of confidence, the lack of self-worth, self-rejection, social anxiety, withdrawal, isolation, anxiety and depression, they are all part and parcel of what makes you unique. Now, every singular individual there at some point might have suffered mental health problems without knowing. So let's stop stigmatizing mental health. Let's stop branding women or men that are going through infertility as if they cause their problem. Anybody can have a baby and anybody can have problems, but problems end. Problems give us opportunity to get the best from us. So let's begin to love. Please, let's begin to care. Let's begin to direct. Let's begin to counsel them. Apart from praying, apart from going to church, there are practical things that women that go through infertility can go through, especially if you notice you are having depression, especially if you notice you might have symptoms of sleeplessness. It doesn't just start. And when you are having all these problems, unfortunately, you can develop general health problems. So majority of women can be hypertensive, majority of them can be diabetic, and majority of them can have cholesterol problems because your lifestyle is not healthy. You begin to do all the unhealthy things. You begin to say, well, what do I care? Who do I care? So you begin to not take good care of yourself, and it's not a good place to be. Then we can get help. So the further into treatment a lady goes, the more she will likely display the signs of depression. So if a lady has been wanting to become a mother for 10 years, the possibility that lady can easily be prone to developing depression and anxiety is very high. Now, remember that the management of infertility itself can also cause a lot of toll on you as a person. Okay, so that's my quick presentation. And I'm going to open the clinic now, and I will encourage you to feel free, please. Feel free to ask your questions. We're going to interact. It's going to be a very informal question and answer clinic. So please go ahead and ask your questions and I provide you feedbacks. Okay? Feel free to ask your questions. In next 10 minutes, we interact and you enjoy your evening. Remember the big event we have on the 31st? Gynecological Disorder Masterclass. You do not want to miss this. If you have any problems in any of these female reproductive system, in the vagina, in the cervix, in the womb, in the tubes, in the ovaries, please call Let's Fellowship. If you have fibroids, adenomyosis, endometriosis, and all those oses, come as you are. We have a very rare privilege. A professor of obstetrics and gynecology who happened to be my teacher in medical school. He honored our invitation. So let's show up and make sure we learn from the best. Remember, infertility ends. So make sure you register for that event. Registration is currently ongoing. But right now, please go ahead and ask your questions so I can provide you feedbacks. Do we have any questions? Okay, here we go. I know admin would definitely have lots of questions for me. How can couples struggling with infertility minimize their risk of mental health problems? Now, this is where communication matters. Communication. When you don't understand, ask. There is no way you will be together and your partner will know what's going on in your mind if you don't express yourself. We must work as a tag team. Like I told you guys, the best guy can crack. The best woman can crack under infertility. Suddenly, your wife is very irritable. Suddenly, she has a short fuse. Suddenly, your husband is no longer coming home. Suddenly, he's going all over the places. You are blaming each other. You are not seeking solutions. You see, when you go out there and you take a lady, for better, for worse, infertility is part of the for worse, but it's temporal. So the biggest tool, the biggest help you guys can leverage on is communication. Communication. Understanding is going to end. Getting the best professionals, getting a fertility specialist, getting a counselor, exercising, sleeping, eating good food. If you can flip your lifestyle to the positive direction, inadvertently, you are improving your hormones. Inadvertently, you are improving your chances. We have seen couples that we are shopping for money for IVF, but we canceled them. They went back. They started talking. They started going out. They started going for vacation. When there was a particular couple, they've been married for 7 years. They have never gone for vacation. Why? Because the society has placed a big burden on the young lady that within 1 year they will start counting for you. So she was undergoing a lot of societal pressure to prove herself as a virgin, which was handed over to the husband. Unfortunately, after 1 year, no baby. And the marriage that everybody believed was made in heaven started struggling until they sought for help. What did we advise them to do? Go on vacation. Forget everything about all these things, partner. Go back to the days you guys were friends. Crack joke about this infertility. There are some couples that crack joke about their infertility. They yab each other before you know it, they become pregnant. They went on vacation in Ghana, and before you blink, a 6 years infertility ended. There are some couples that might don't have money for IVF, for IUI, but they go back on, they are happy, they're exercising, they're making love, and blink, they are pregnant. Our body is very sensitive, especially the body of women. Anything that upsets the entirety of your body can lead to infertility problem. Anything that makes you to be in a bad place can flip your cycle. And when your cycle is abnormal, your problem begins. So communication is the biggest tool you will use. And when you communicate better, you can seek help from a fertility specialist. And when you seek help, assuming we tell the man, oh, you're the problem, you don't use this problem to attack him. You don't use low sperm count to attack him. You don't begin to compare him with other people. You begin to see this as your own problem. The same thing is applicable to the man. You don't tell the woman, I had kids previously, go and sort yourself out. This afternoon, a lady broke my heart. A lady of 46. that had a couple of issues that put her in a bad place. And the partner told her, go and sort yourself out. Who are you telling to sort out? We are talking about your kids. We are talking about your generation next. So we have to present ourselves as a tag team. Okay? How does one know if they are unwell enough to seek mental health treatment? We all know our baseline. Okay? Now we have to extricate ourselves from overt spiritualization, overt religiosity. When you are not well, you know. Especially when you have crossed that mark of expectation. So if you're 35 and above, and after 6 months, you know definitely where that age is not on your side and you're not getting results, you begin to seek help immediately. So the point of knowing well, it's actually dependent on how you're presenting. If suddenly you've lost sleep, if suddenly you're withdrawn, if suddenly things that used to make you happy are no longer making you happy, if suddenly your partner, you see your partner that used to be your best friend, you guys are enemies, you're always quarreling, that's a red flag. Seek help. Sometimes you need to go for counseling, genuine counseling. Not anytime you go, they say, oh, go and do this, go and pay this money for cleansing. No. Every problem has a solution. So knowing when your body, your mood, your everything has transitioned, even your sexual life. Previously, you guys used to eat love making like anything, but suddenly in a month, you guys have not made love. That's a red flag. You cannot be looking for a baby and you're sleeping in different rooms. You know, things that used to make you guys happy suddenly is no longer making you happy. That's a big red flag. Seek help at that point, okay? What can we do if we are worried about a friend, family members' mental health? Now, we are all our brothers and sisters keepers. We can communicate with them from a place of care, from a place of love, not from a place of condemnation. It's tough to convince someone they have a mental health problem, even in this part of the world. But you have to understand that anybody can be down. Most people will not even tell you their problem. So sometimes it will be tough to break into that defense to actually begin to convince that particular family member that they need help. But we have to approach it with love and care. It's all about approach. I will personally say this. If you notice any of your relatives exhibiting signs of mental health problems, please guide them appropriately. Don't give up. Don't go one time and tell them or you want to bully them into submission. No, use diplomatic TLC approach. Possibly pay for their services. Go to them, just keep them company. Find out if you can get to the roots, then you make recommendation amicably. It works. Love works. Don't impose it on them. Don't be judgmental. Don't compare them with anybody. Don't begin to make sense of what they are going through because you don't know. So the best you can do is to use love and care, approach them, then you make recommendation, then you follow up. And if they are not in a position to get help from what they need, you can opt and give them that help. So if you are financially stronger than them and you know they might not afford the services, you can give them that services they need. It's called love. Okay? What kind of healthcare provider does one go to if they need help with mental health issues? Thankfully, besides psychiatrists, which are specially trained doctors in issue of mental health, there are so many mental health staff out there, so many mental health workers, pretty much all over the place. You can start from counseling. You can start from, a care provider. You can start from a case manager. You can start from just the basics. And they're all out there. And there are even some people that are trained in mental health issues that might not really have strong medical background, but this is their area. And you can even have this in your organizations. So you can have it in your church, you can have it in your social, group. You can just have it in your organization. There are so many organizations that make provisions for workers' mental health, because when your mental health is affected, it's going to affect your work, it's going to affect your family, it's going to affect your productivity, it's going to affect everything about you. So there are specifically trained mental health workers that can help you based on your need. Now, if you have a need for clinical consultation with a mental health provider, then you need to step up. You need to go through the ranks and files of getting a referral. Then a professional will take care of you. And if need be, they will recommend medications for you. Thankfully, majority of the mental health problems are very responsive to talk therapy. Okay? All right. Lifestyle behaviors that will improve your mental health. Admin, you've just asked the best question this evening. Change virtually everything about you. I don't expect you to be having mental health problems and you're still drinking alcohol. You're still drinking your soda. You're not sleeping. You're not drinking your water. You're not exercising. Every single thing you know that might push you down where you don't belong to, come back there. No alcohol, no smoking, no soda, drink more water, sleep. Sleep is huge. Exercise. Exercise is one of the biggest benefits of just taking charge. Why? When you are exercising, you're releasing a counter mental health problem hormone. We call it endorphins. When you are sweating, when you are in a good place, you release these endorphins. They make you feel so good. Endorphins are the same hormone you release when you have climax in cause of sexual activity. So flip everything negative, eat healthy, exercise, avoid alcohol, avoid smoking, then avoid toxic relationship. There are so many friends that are not healthy. You have to cut them off. Very important. Anything you know that will not help you, cut them off. Even your social media, mind the groups you belong to, mind the friends you hang out. There are some people that post their events to intimidate other people. There are some of your friends that everything about them is positive. Every time they post stuff, they keep inviting you. None of them have really encouraged you. You know the kind of people you call friends. You know the kind of people you tell your problems. And you don't tell people your problems and they go there and they publicize it. Mind your company. Very important. Some of them might be your siblings. Some of them might be your mothers. If you need to cut them off, cut them off. Look, I know what I'm telling you. Nobody can understand what you're going through, no matter how you explain it to them. Okay? All right, guys, my time is up. My next clinic will be on Saturday. Hopefully, we're going to run that clinic because it's a day before our event. But hopefully, we're going to run the clinic. If you're in our Facebook, remember tomorrow we have a community health open clinic. So we're going to get a topic and we're going to discuss it. But guys, thank you so much for coming this evening. If you have not subscribed, please just spare 1 minute, click on the subscription button, check the notifications so that anytime I come live, you will join the clinic. Thank you for this evening's clinic, and I'll see you guys again on Saturday. Remember, Saturday's clinic is by 12 p.m. Eastern Time, 5 p.m. Nigerian time. Tuesday's clinic, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. Until I see you guys, take care of you and bye-bye for now.